Hello and welcome to the News by Standards. Cambridge University is holding a review after 5 students died in recent months. One of the deaths, which all happened between March and June, has been confirmed as a suicide, while 4 others are suspected suicides. Senior Pro-Vice Chancellor Professor Graham Virgo said it had distressed the whole of the university community. Learning from an initial review after the first 4 deaths was being used as part of ongoing plans, he added, a second-year history student died in March 2022, 3 other students died in May, and another died in June. History students' inquest heard he was on course to finish as one of the most accomplished students in his year. Cambridgeshire and Peterborough Assistant Coroner Simon Milburn said there was absolutely no indication that he was struggling. The inquest heard he had no contact with college counselling services, and his GP confirmed there was no history of mental health issues. The head of Charity Survivors of Suicide, Claire Curran, who has been supporting his family, said like any family who are bereaved by suicide, they are devastated, they are distraught, very traumatised, really struggling to get their heads around what's happened, immense sadness. This is not the kind of death that anyone ever wants to experience. She added it was really important to let people know that there was support services available to make sure they were accessible when needed. Cambridge University has collated the number of student suicides since 2017 and 18, according to a Freedom of Information response. Over the 4 years prior to the 2021-2022, 4 students were confirmed to have died by suicide, with 1 suspected. Following the 4th death this year, the university approached the NHS and public health agencies to set up an investigation group to review what has happened and what the lessons are that we can learn, Professor Virgo has said. One thing that came out of the review was that there was no common cause behind these students' deaths, but we have, reflecting on the discussions arising from the review, considered various aspects of our practice, he said. We already have, for example, training relating to suicide prevention, and we want to ensure that training is as good as it possibly can be. The 5th death occurred after the start of that review and is currently under review itself. These reviews are separate from coroner's inquests. Professor Virgo said we consider all the student deaths that have occurred at the University of Cambridge to be tragic and very concerning. We are not in a position to speculate as to what has happened in these cases, but we are engaging very carefully with the whole student population, with professionals within the university and outside to get a better understanding of what might be going on. I'm not yet in a position to say it is one particular cause. It is undoubtedly complex, but is something that we are seeing throughout the country and certainly throughout the university sector. In 2021, 2,123 students accessed the university's central mental health services, while 453 used college-based services compared to 1,655 and 136 respectively in 2017. Ben Dialetz, the Students' Union Welfare and Community Officer, said that universities have been tasked with creating a suicide prevention policy by the government, but an initial draft of Cambridge's had been altered quite a lot. University senior leadership buckled under pressure from the heads of colleges to water down the policy, and we've been really quite concerned to see what started as a conversation about student safety turning into one that's really about legal liability, they said. Professor Virgo said the university already spends £4.5 million a year on mental health and well-being, and will be allocating an additional £5 million over the next 5 years. Working together, the university and colleges have been developing and implementing an action plan, much of which was in development before these tragic deaths, which further enhances the support available for students, he said. He said the plans included an increase in investment into the university counselling services and dedicating well-being advisors in colleges to enable early identification of students in distress. A spokeswoman from Cambridgeshire and Peterborough Integrated Care System, ICS, which was involved in the review, said, we want to express our deepest condolences to the families, and our thoughts are with them and friends of those who have been affected. We're committed to working together to ensure that we support our most vulnerable people with managing their mental health. According to the most recent data from the Office of National Statistics, published in May, the suicide rate for higher education students in the academic year ending in 2020 in England and Wales was 3 deaths per 100,000 students, the lowest rate in 4 years, between 2016-17 and 2019-2020. Students also had a significantly lower suicide rate compared with the general population of similar ages. Professor Steve West, the president of University UK, which represents 140 universities, said the sector shares a resolute commitment to prevent student suicides. Across the UK, we are seeing an increase in the number of young adults experiencing mental ill health, and this is is reflected in student populations, which with increasing demand for support and treatment both in universities and the NHS. Whilst there is no evidence that overall numbers of students' deaths by suicide are increasing, risk factors such as self-harm, depression, debt, disengagement and loneliness mean that universities need to be vigilant to spot the signs and respond quickly. Ms. Curran added the history student's family would say that no matter how bad things are, ending your own life is not the answer. No family wants to go through this pain, no family wants to feel this devastation. Please, please, please talk to someone and get some help, because people really do care.